Friends, we have a great show for you today. Our special guest joining us from Abuja, Nigeria, is Dr. Shehu Usman Adamu. Dr. Usman is a fellow at the African Institute of Public Health Professionals in Nigeria, and he is a member of the American Public Health Association. He is also professor of public health and dean of health sciences at National Open University of Nigeria, Abuja, and he did his public health training at the University of Liverpool. Dr. Usman is also a former legislative member of the Kaduna State House of Assembly in Nigeria, where he served as chairman of the House Committee of Health from 2011 to 2015. I recommend following Dr. Usman on Twitter. His Twitter handle is at DRMODIBBO, the number one. I'm going to repeat that. It's at DRMODIBBO1. Follow his account for the latest updates on public health in Nigeria. I should say Twitter is presently shut down in Nigeria, but we are hopeful it will be up and running soon. Dr. Usman has joined us to speak about the latest on the state of COVID-19 in Nigeria. Why Nigeria, you may ask? Well, Nigeria is being closely watched by professionals of various disciplines. It is a growing power with a rising entrepreneurial class. It is also Africa's largest economy, its most populous country, and a nation that is on track to surpass the United States in population by 2050. I'm pleased to have Dr. Usman here with us today. Thank you, Dr. Usman, for joining. How are you, sir?
Fine, thank you as well, Ted, for giving me the opportunity and for the invitation. I quite appreciate.
Well, the pleasure is all mine. I wanted to
Thank you.
start off and ask you, what is the latest with COVID-19 in Nigeria? Which areas of Nigeria are most affected and in greatest need?
Thank you very much. As you know, the pandemic hit almost all parts or countries of the world. And when it was here in Nigeria, we have epicenters where we call epicenters because of high population, like Lagos State. Lagos State had the highest number of COVID infected individuals of about 58,381. Even currently, as at today, as at yesterday, 16th of June, there were a report of about 8 new cases, confirmed new cases of COVID. But I believe still Lagos State is a leading state. And Lagos was the epicenter because basically of two things. One, high population in Lagos, because it's a very large metropolitan area with over 10 million people. And secondly, is one of the largest and busiest international airports it has one of the busiest airports in Africa. So many travelers coming back to Nigeria come back through Lagos International Airport. So you can see that was why it was an epicenter. But generally, all the 36 states and Abuja had their fair share of the total number of infected cases, which stood at about 167,000 confirmed cases, which was distributed according to the all states, but certainly with Lagos and another state in the northern part of the country, which is Kano, also has highest number of population and also a busy airport. So those are the two attributable reasons why those states had the highest number of COVID infection.
What is the status of the COVID vaccine rollout in Nigeria?
Well, actually, the vaccine has been rolled out, and it was quite enormous because as at 1st of March, the COVAX shipped about 3.9 million doses of the AstraZeneca, that's the Oxford vaccine, that's the AstraZeneca vaccine, which was manufactured by Serum of India. So Nigeria received about 3.9 million. And by March this year, again, another consignment of about 300,000 was received. And the rollout was in all the 36 states and the federal capital. However, as usual, we are a population of about 200 million people. So as taking about 3.9 or 4 point something million doses is actually not going to go around the entire population, particularly the elderly population that need to be vaccinated. But actually it has rolled out in all the 36 states and the federal capital, Abuja.
What is the total number of doses Nigeria needs?
Well, the total number of doses the country needs about up to close to 100 to 120 million if we want to achieve herd immunity. Because since we have about 200 million or over, so we need to vaccinate at least more than half of that or close to half of that if we have the intention of achieving herd immunity. So using about 3 million or 4 million is still far behind the actual doses are required. But notwithstanding, at least it's good effort that the government has acquired the vaccine and we have started the vaccination. It's better than not starting at all.
And what's the total number of doses the African continent needs?
Well, if you look at the continent at large, you have to see the population and then maybe see half of it, half of that need vaccination. But the major problem is the vaccine production. If you look at the countries that are responsible for producing the vaccines, they are also in need of those vaccines. Particularly if you look at India, India was hit severely by the third wave. So much so that the Serum India that received contract from other countries to produce and ship the vaccine decided to give the vaccine only to India to use domestically so as to reduce the number of cases. So that has also affected not only Nigeria, but other African countries in terms of getting enough vaccine for vaccination. And then this company itself, Serum India, is still unable to meet the requirement of India. And they are attributing that also to shortage of raw materials, which they are importing from the United States. And the United States also need those raw materials to produce the vaccine. So if you look at it, basically, there is acute shortage all over. But what the whole world should do and come together is to treat the issue as a global issue. No country should be left on its own to fight COVID. Because if countries are left on their own, if their healthcare facility and the vaccination and they don't have the foreign reserve to buy the vaccine, if they are unable to do it, that means COVID will still be lingering over and over without it going away for quite a very long time, which is also very dangerous for the human population.
Now, has the Serum Institute of India provided you with an estimated timeline as to when they'll be able to export the vaccines to Nigeria and other African countries?
Well, if you look at it, since April this year, they gave a press statement, which is in their website, saying that 50% of all their production is going to stay with the federal government of India, and another 50% is going to be distributed to the state governments in India, that's the regional governments in India. So it means for now, there is no date for them to start exporting. Because in one of the interviews also given by the company, which was monitored by New York Times, the person that was interviewed is the head of the company in London. And he's also saying they are unable to meet the Indian demand. So if the company is unable to meet the Indian demand, so there is no day, no given date that they can say they are going to supply. One sad situation is that they took money from a neighboring country, which is Nepal, that they are going to supply Nepal with vaccine. They supplied Nepal with half of their vaccine requirement and refunded their money, saying that, look, we can't keep giving you vaccines. We also need the vaccines here back home. And the fact that you are paid for this much number, 2 million doses, we are only giving you 1 million and take your money back. So if a manufacturer is returning people's money, you see there is no estimated date of saying that, okay, possibly within such period of time, he or the company is going to produce enough vaccine that is required.
This situation that you're describing and that we've been reading about in the press shows an obvious shortage of vaccine manufacturing ability worldwide. Um, does Nigeria have plans in the works to scale up their vaccine manufacturing capabilities?
Well, I believe we have, and if there is any advantage I can say, if at all we can look at it as advantage of COVID-19, is that it has pushed Nigeria, the government and the private sector to have more investment in the health sector. Because when the pandemic started, there was unprecedented acute shortage of facilities. But before you know it, the federal government set up a committee. They gave state governments money. Individual respective state governments set up a committee. Money was pulled over from for other expenditures, particularly that there was lockdown, and was pushed to health. The National Disease Control Center, that's the NCDC, was also fully funded and their research capabilities have been boosted. So the health sector has witnessed a tremendous improvement as a result of the COVID. So having said this, I believe the National Center for Disease Control and the Virology Research Center will now kick up their investigation and research activities towards vaccine production. But as you know, vaccine production differs from other normal manufacturing of drugs. It takes time, research over research to find the suitable antigen that will be used. And then it also has to undergo several trials before we can. But certainly with time, Nigeria will boost its capabilities of producing a vaccine to take care of future occurrence of such pandemics.
Dr. Usman, in your view, is a patent waiver on COVID vaccines the right thing to do? And if so, why?
Yes, in my opinion, yes, it's a good thing to do, because if the companies that produce the vaccine are keeping the patent, it means others cannot copy it and produce, and they themselves cannot cope with the demand of the vaccine. So as I have said earlier, the pandemic should be given a global approach. The control should be given a global approach. Anybody holding this vaccine formula or production pattern or whatever should just paste it in a notice board. Say, look, guys, this is the formula. Come and copy it and produce. But make sure you follow the right steps and produce the right thing so that people can be vaccinated. If we rely and continue to rely only on those that were able to produce the original patent, and they are the only ones that can continue to produce, that means we will stay where we are for a very long period of time. Priority will only be given to countries hosting the companies, countries with enough money to buy, and countries that are politically in the upper political niche of the global politics. African countries and other developing countries will be left to suffer for the inability to produce the vaccine, and for inability of other companies to produce because it has been patented. So the patent right should as well be given, should be waived. This is my opinion.
India's second wave of COVID, which we've all seen in the media, has left such great suffering in that country. It's also created situations where areas of India have been in short supply of medical oxygen. They've been in short supply of hospital beds and healthcare workers. Dr. Usman, to your knowledge, are African countries at risk of running into similar situations?
Well, this pandemic, if you agree with me, has stretched the healthcare facilities not only of African countries or India, but the world over. At the middle of it in 2020, we have witnessed developed countries having shortage of ventilators, having shortage of bed spaces, because the unprecedented number of people that were admitted has stretched the limit of the healthcare facilities of even the developed countries. So if it does that, it certainly does also stretch the limit of the developing countries. Currently, India is suffering from this pandemic, the third wave, and a lot of people are being infected, and their healthcare facilities is been stretched to almost its last limit. So comparing the healthcare system in India and that of other African countries is more or less similar, with that of the India being stronger than that of most countries. So during also the pandemic here, most African countries have stretched their health, the limit of their health facilities. You find that like here in Nigeria, isolation centers were constructed in stadiums where people are going to play games and sports were converted to isolation centers so that there will be more hospital beds, more facilities to take care of the infected people. So certainly, we are not praying for the third wave, of course, but if for any reason it continues and hit Africa, it's going to hit Africa in such a devastating manner that the healthcare facility cannot cope.
In which areas and which capabilities does Nigeria need to scale up to fight COVID?
Well, during the pandemic, as I have said earlier, the government has tried because a lot of health facilities were renovated, hospitals' beds were made available. But then if you look at it critically, there is acute shortage of manpower. This part of the world is having shortage of health manpower, not because we don't do the training, but because they don't stay, because of the brain drain. You go to other European countries, I will not mention names, but there are European countries where over 20 to 30% of the nurses are Nigerians. If you go to other countries, it's the same thing. So manpower developments, because we reached a stage where there were hospital beds, there were facilities and equipment, but there was no manpower to handle such things. So one of the first thing we need to do is to scale up our manpower. And also, besides scaling up the training and retraining, we also need to motivate and possibly increase the pay so that the manpower can stay behind and work for the people. Another thing is to scale up research. Once research is scaled up, possibly the health sector is going to be okay. But all those things now need what? Funding. And you are aware of the global meltdown. I believe everyone knows that as a result of COVID-19, there were global meltdown, currencies are suffering from, countries are suffering from one economic crisis or the other. But notwithstanding, the government needs to do some readjustments, stop some spendings, particularly that are overhead in nature, recurrent, and then divert more money into health facilities in terms of capital development and efficient funding. Once that is done, Nigerian health system is going to be strong, I believe.
What is the best way to safeguard Nigeria against other emerging disease threats? And in which ways can disease surveillance be improved in Nigeria?
Well, if you look at COVID-19, as I have said, the surveillance, about only 2 million people were tested. So if you take the population of 200 million and then only 2 million were tested, that means a lot of needs to be done, need to be scaled up. The level of surveillance was very, very low. But then the surveillance, as I've said, can only be improved as a result of improved in manpower. That's training, having enough people at hand, epidemiologists that will go out in the field, and then health education. Because there are certain times people were afraid to even be tested so that they don't want to go to the isolation centers. They will be taken away from their families, and people were running away from being tested. So health education will also help, because by the time you bring out a health program and if people are not properly educated, if they don't key in as a community or as a society, then you are going to encounter a lot of problems with such surveillance and other health objectives cannot be achieved.
What is the state of other diseases in Nigeria, in particular malaria, HIV, and TB?
Well, so sad to say that malaria is one of the most endemic diseases here in Nigeria, because as at 2019, the WHO reported that about 25% of global cases of malaria That is 25% of the total number of people infected with malaria are in Nigeria. The same thing with TB. We are still leading in TB burden at about 14 countries in the world are having these high cases of TB, and Nigeria is still leading. And then also in HIV, even though in HIV the result released by government shows a significant drop from 2.8% that was that we were having to about 1.4% in about 2019. So you can see there is a significant drop. However, malaria still remains a problem, particularly that we are in tropical area, and it's one of the tropical diseases which relies on an insect vector, the mosquito, which does very well here because of the river and other water bodies where mosquitoes can breed. But the government is still doing its best to see that there is a reduction in these cases of malaria, but all hands need to be put on deck. All hands, I mean, is that even the developed countries should continue to support research in these diseases, because most of these diseases are neglected. That they are even called neglected tropical diseases, like schistosomiasis, onchocerciasis, and malaria, and things like trichomoniasis and things like that. So all those ones now, draconiasis as well, has been part of the neglected tropical diseases. And recent studies has shown that in Nigeria, we still have, beside malaria, all those other tropical diseases, like trypanosomiasis, for instance. A recent study we conducted, we found that the vectors, that's the CSA fly, are still thriving in part of northern Nigeria. And when we investigated, we found that some of the flies were infested with the parasites. We went ahead even to do check it at molecular level. We found that those parasites were the same parasite that have been infecting people over the last decades. So there is actually need, there is need for greater attention for these neglected tropical diseases. These developed countries should continue to fund the WHO, which was funding research in this area. HIV has been declining, even though we are still leading in this country. But when I say leading, you also have to consider our population, because we are a very populous country of about 200 and more million people, which you say may likely surpass United States of America by 2050. So if you look at the population, that is one of the factors that makes us to be having this high number of cases. But they are still a burden, and we are still working towards eradicating or reducing the burden of such neglected and tropical diseases.
Dr. Usman, how is Nigeria raising its next generation of epidemiologists, physicians, and healthcare workers?
Well, as I have said earlier, the issue now is training and retraining. Nigeria is highly concerned about training of health workers, because of recent, there was a bill that was passed in the National Assembly for the establishment of a specific university of health sciences, which I think is going to be situated somewhere in the north central part of the country. The health science university is going to boost the development and the capacity of manpower production and research as well. Training and retraining also of the existing manpower also need to be done. And then the issue of funding. Currently, I am aware that the National Universities Commission is reviewing the curriculum of health to standardize it with what is obtainable in other universities across the world. So once that is done, I believe in the near future, we'll be having a large number of epidemiologists, particularly if this new universities start graduating people with degree in epidemiology, higher degrees in epidemiology and surveillance of diseases and health system management, and all other aspects of health and public health. The manpower will be boosted. And once we have the enough manpower and adequate funding, then Nigeria is going to find itself in a right footing in terms of health.
We know that there will be future pandemics. How should we be modeling epidemics to make reliable projections?
Well, I believe, as I have said, COVID-19 has gave the world, the entire global community, a lesson. One, the very big lesson is that no country is safe or is immune from attack by a pandemic. Countries can develop weapons, can develop air surveillance, sea surveillance, and other form of surveillance to protect themselves from attack by man and military machines from other countries. But if you look at how the virus went viral within a very short period of time, you will agree with me that no country is isolated from the danger. Now, since no country is isolated from the danger, what we are supposed to do is to take it as a global issue. The whole world should come together and bring out a pandemic fighting approach system, whereby countries that do not have strong healthcare system, do not have strong surveillance system, do not have enough money to purchase drugs and vaccines should be carried along under the same umbrella so that the entire world can now be protected against another pandemic. But once we allow each country to be on its own, then certainly some other countries cannot measure up. And once other countries cannot measure up the disease stays or attack or affect people in such countries, it still stands the chance of being transmitted to other countries that are protecting themselves, because the whole thing doesn't have a border, no barrier. So the whole world should come together and design a surveillance system that will be worldwide in nature, that will also assist other countries that are not strong, as I have said, so that at the end of the day, the world can fight pandemic together, not each country allowed to fight pandemic or each region allowed to fight a pandemic on its own. This is my actual view on this issue.
Dr. Usman, can you recommend any news sources on the COVID situation in Africa that we should be following?
Yes, the Nigerian Center for Disease Control have a very good website, ncdc.org, I think. That website will give you ample opportunity to know what is happening within the country, because they update it almost on hourly basis, morning, afternoon, and evening. As soon as cases are recorded, the website is updated. So it's a reliable source. And from there, you can also have other linkages. And then the WHO also have an all-encompassing website that allows people to view what is happening at other regions and other countries, as I have said. So that, I believe, is another good site that you can follow. And any other person that is interested in knowing what is happening, either about COVID or about health, can as well log into the World Health Organization website, which is a very resourceful site.
Well, Dr. Usman, I can't thank you enough. I really appreciate you sharing this important information about the COVID situation in Nigeria and Africa more broadly, as well as informing us about needed public health measures worldwide. So you've really helped to raise awareness, and I appreciate you joining us for this discussion.
Thank you so much, Ted. I equally appreciate you for giving me the opportunity, and I wish you are close enough so that I can give you a face mask free of charge, a brand new face mask.
Thank you.
As my own contribution towards your safety.
Thank you, sir.
Thank you so much, Ted. Yes, I appreciate it.
All right.
Bye-bye.
Be well.
Yeah.